Hello and welcome to the 2019 edition of the International Society for Magnetic Resonance in Medicine meeting in beautiful Montreal, Canada. My name is Brian Casey. I'm editor-in-chief of AmpMini.com. So the focus of today's sessions here at ISMRM was machine learning applications in healthcare and in MRI specifically. Dr. Bradley Erickson of the Mayo Clinic was one of the speakers this morning. Dr. Erickson, thanks for being with us.
My pleasure.
Yeah, so one of the things that you focused on specifically was clinical applications of deep learning and specifically how they are being used in MRI. What were some of the things that you touched on today?
So deep learning is a wonderfully powerful technology, and it's going to have a number of applications in medicine, but the three components that I think are important are that it's going to allow us to segment or identify important structures in medical images automatically. The next thing is that it's going to let us classify them. And then an exploding technology now is called generative adversarial networks. And so I think those are the three basic components that we think about.
Okay, on the first application, what's going on in that area?
So we are able to develop machine learning methods and deep learning methods in particular that will automatically identify major components of the medical images. So for instance, in the case of a CT of the abdomen, it will find liver, spleen, kidneys, aortas, all those sorts of structures, and it will do that fully automatically. And I think that in the past, we always used to worry that it would take so much work to identify structures that we would just kind of eyeball the thing and say, that looks too big, looks too small. But I think if we can automatically identify what those structures are, that then we can start to build large databases and say, yeah, it might be too big, but in this patient, because their body mass is such and such, or because they're a certain height and weight, it's okay. Or maybe it's the other way around. The other thing is that once we start to segment it, we can then start to measure more properties than just volume. We can measure out the density of it, we can measure textures, and it turns out that texture has a lot more information than what we could really appreciate. We often talk about things like ground glass opacities and whatnot in the lung, but that was really not a quantitative thing, and what was ground glass to me may be different than ground glass to you. And I think that the ability to be quantitative and objective is really the next advance that deep learning can do.
Okay. Now, the final one were these GANs algorithms. Can you explain a little bit about what those are and how they're maybe different from some of the machine learning algorithms that we've become accustomed to?
Sure. So in traditional machine learning, we say, here's an example of disease X, and here's what it looks like on the image. And so we would basically do a transform from the image to the diagnosis or to the segmentation. In the case of generative adversarial networks, it gets its name because we have one thing that's the database of the images, and then we have a generator of images. So this is where you create the deep fake images, you can create pictures of people or whatever, and then you have another component that learns, and it learns to discriminate between real and fake. And now you've got a contest going on. That's why the middle word there is adversarial. So I have a generator that's trying to make images that look just as real as possible, and I have a discriminator that's trying to figure out fake versus real, and they keep competing against each other and creating better and better images. So that may seem kind of useless if I'm just trying to create real images, right?
Right.
Well, but what if instead you say, well, here's a CT image, but I'm going to make it look like an MR image.
Okay.
And so now you can start to use this technology to, for instance, create a CT image from an MR image, or an MR image from a CT image. That has a lot of uses.
Yeah.
You can imagine that, for instance, in the case of MR PET, people are using it to create a CT image and then do attenuation correction. In our case, we have the CT algorithm for identifying structures, but if we can convert an MR to a CT, now we can use our CT algorithm on MRs. And you can also do it within modality. People are showing that they can, for instance, create a flare from T1 and T2 weighted images. And so the ability to create new images or create images that we're familiar with from a much more reduced set of images is going to improve efficiency, but it may also reveal a lot of information. Because now if you think back, that component that generates the image, how did it know to create that image? there has to be the nucleus of information in that generator that says, this is what a disease looks like, or this is what a T2 looks like. And I think that that's where the explainability of these systems is really going to explode now.
Yeah.
We're really going to learn, how do we generate an image that has a certain disease or has a certain findings?
It sounds like you could really reduce the number of scans that patients are getting by doing that, the number of retakes, a lot of applications.
Yeah, reducing dose is another application where you can do a CT with less dose, or if you're doing PET imaging, you can inject less agent there, less acquisition time in the case of MR. It's extremely powerful.
Now, in the conclusion of your talk, you were pretty optimistic that a lot of these tools are going to become more commonplace more quickly than we ever thought.
You know, I think the challenge is that we often tend to look backwards and say, well, 2 years ago, this is where we were. But this is a technology that really relies on exponentials. The major limiting factor is data annotation. We understand these algorithms and how to apply them to do segmentation, for instance, quite well. The real limitation is data sets. But once you start to annotate a data set, the machine can learn from that and it can improve your efficiency. So now you can annotate data sets much more rapidly. And that means now that you're going to have an exponential increase in the availability of annotated data sets. And so I think that the explosion is just going to go much more rapidly than we expect.
Very good. All right, will be something to look forward to. Thanks for being with us.
Thank you. My pleasure.
Brian Casey signing off for AntMini.com.